So Kelly Leuck, you are a nurse practitioner and you are one of my personal heroes for the work that you and your whole team are doing. I know I can't say the name of the hospital that you're in, but you are in New York in the absolute thick of it. And the hospital that you're at is nothing but COVID patients. Is that right?
Nothing but COVID. We do have traumas. It's a level 1 trauma facility, so traumas are coming in, but they're all, if they're traumas and they stay in the hospital, they turn COVID. So yes, everybody's COVID. They come in, and if they don't leave, they're COVID.
Yeah. So you have been there. Remember when you flew, you were actually doing a job in Portland. You live in the Phoenix area, and you flew directly from Portland to Manhattan to join in this fight. And how long have you been there now on the front lines?
So 3 weeks, actually 24 days actually, as of today.
Yeah. So you have seen it really progress. What would you share with people on what you've learned?
There's 11 state hospitals in the Brooklyn area and New York area. They're all county hospitals that are very low income, low socioeconomic status, and very poor health care. Honestly, it's like a third world country here. I've never seen anything like it. They're not getting the treatment that they probably deserve. We all deserve the same treatment, and there's no nursing staff ratio here, so it can be one nurse to 20 patients, and just basic care is not being assessed. Or not being taken care of. Just water, just food, just getting somebody up to go to the bathroom, things of that nature, which is the most important in nursing care, just in taking care of a patient. There are all of the ICU beds. They have 4 other makeshift ICUs that are all vent patients. So
you said vent patients, meaning they're on a ventilator?
They're on a ventilator. Mm-hmm. And usually when they come in and they're on the ventilator, they don't come out. Some are improving, but I would say majority are not. I think they have 100 beds in this ER, but I'm not really sure. But at any given day, it's full, and the hallway beds are full. So there's 2 to 1 bed. There's 2 to 1 area. They push 2 beds together. Then they have hallways all with gurneys lying down all the hallways of patients just laying there. So there's no room. And then they're trying to get them moved to the ship, but there's guidelines for that ship. And so unless they meet the criteria and guidelines, they're not getting moved. It's really interesting, and I'm not sure who they're choosing this for, but they're selectively picking patients to go there. And it's the director here told me that he can't send anybody out. It's just baffling to me. Then they have the Javits Center that has 3,000 beds. Where are all those patients?
You can't serve them. You're not able to. You don't have the resources, and yet you are prohibited from sending them to a place that's basically empty.
Absolutely. And then just the last 4 days, we've been without oxygen cannulas. We've been without non-rebreathers, and they're running out of supplies and PPE. Now we have those plastic gowns, which I guess is just as good as anything, but we're using the same non-rebreather mask for up to a week, which they leak. They don't hold their form. The problem is they don't have enough supplies, and so we made makeshift non-rebreathers yesterday out of tape, simple masks, and gloves, and it worked. But
Right.
Otherwise, you go down the hall and you see a patient on a non-rebreather mask and it's deflated because the oxygen's out, and no one's changed it. And they're sitting there rebreathing their own CO2. It's just not even okay. So you take it off their face so they don't retain that, and you take it off, and then we go find a oxygen tank and put it back on and switch it out because they're not being paid attention to. So I don't know whose fault it is, the system's fault, but it's not like anything I've seen. I mean, in Arizona, we have it really well. We have it really, really, really made. And the patients who go to Arizona, if they came to New York, especially in the inner city, they would think it was a third world country. There's no doubt.
So what would help? Is there anything that would help from your perspective?
staff policies, and then when we're in a national disaster, not to require politics that are involved to, when we got here, the nurses had to do orientation with HIPAA, OSHA, all these things that they already have standardized for their evaluations in order to start work. I mean, really? We're in a national crisis and they're having to redo sexual harassment? Are you kidding me? It's just a joke.
So you've worked in ERs for, how long? How many years? You've been an ER nurse practitioner, over a decade. And so you've seen it all. And then you go to New York to help. And I was shocked when you got there on a Saturday and you weren't able to do anything. They had you on the sidelines, literally could do nothing to pitch in until when?
We waited 2 days, 48 hours. The average is they have any given day 300 to 500 nurses waiting for assignment for 2 days, 2-3 days before they even come out, because the hospitals are requiring all these red tape when they're desperate for help.
So you arrived on a Saturday and you weren't able to get an assignment until Wednesday. Is that right?
Right.
So all day Sunday, all day Monday, all day Tuesday.
Right.
When they're desperately needing help. And there's a huge group of you. One of the questions a lot of people have asked, I see you're wearing a mask, is does it matter? Does wearing a mask, will that make a difference?
So the COVID is aerosolized. It's in the air. It's particles and droplets, and it can go up to 26 feet. So keep in mind, if somebody's coughing, they can cough that. It can reach that far. So a mask is super important. Do you have to wear a N95 respirator? No. And in fact, if you were inside with someone who had COVID, some of these families are 8 to 10 people to 2-bedroom place. I mean, because it's expensive here. So, and that's in other places. You can see it on the reservations in Arizona, things like that. That would be more so, you would want to wear an N95 respirator. Otherwise, when you're out and about, just wear a simple mask. It's very important. And I see people wearing gloves. They don't need to be wearing gloves, because you know what they're doing? They're touching their face. They're touching the poles. They're touching things. And then they're still contaminating everything. So whether they wear the gloves or not, you wear gloves one time and you touch whatever's dirty and then you throw them away. But people are not using them that way. So they're spreading like wildfire. So if they don't know how to use the gloves appropriately, then they shouldn't. Mask, you should always wear them when you're in public. Outside, no. When I go outside, I don't wear my mask.
Right. If somebody brings a family member to a hospital, they're not allowed in. Can you talk about what somebody should be prepared to expect? Because I know that's a big issue.
So that's going to be probably the hardest thing. That's probably what's been overwhelming me for the last day. So, for example, a patient came in yesterday who had passed from COVID, and the daughter couldn't see her. They wouldn't let her back. And that's the hardest part, is these people are dying without somebody next to them, which is horrible. We're not used to that. We're used to having our family members or someone with us. So of course the daughter was screaming, flooring herself to the ground, crying, yelling that her mom had passed. And it's heartbreaking. It's the hardest thing that you can imagine. And so that's why it's so important to social distance, because you don't want to have that family in there. For example, there was a husband came in, he was critical. We sent him back, and then a week later the wife came in, and poor 2 young kids in their 20s had to watch both of their parents go back. And then the nurse was willing the mom away and the dad away, and I said, wait, let them say bye, because they were, Spanish speaking only, and this man didn't understand what was happening. And I said, let him talk to his son before he goes back, because I knew that he wasn't going to come out. So that's the hardest part. I think I think it's torture, but then you don't want to spread it because they're dying.
Right. Yeah. It's a hard thing that you have to do because there's no other option.
Right.
And in Arizona, we haven't seen the numbers that you're seeing there, and we're hoping that won't be the case. but there's nothing you can do once the numbers are spreading. I think that's the thing that, as I've watched you and witnessed what you're going through, is just how uncontrollable it is. We have some time right now, but it's too late later.
You know, and, you know, I talked to my sister and she's really frustrated. When is this going to end? When is this going to end? And I just tell her, I said, you have to be patient. There's a reason for this. You have to be patient and be glad that you can be home with your family. Be happy that you can go walk outside and catch some fresh air. They don't have that ability here. Everything is on top of each other. All the buildings are together. I mean, there's no reason that Arizona should get to this level because we're so spread out. I don't see it happening at all. I just don't. I think if you're a family of 10 or 20 living in one space, maybe something like that. But, you know, social distancing is for a reason. You know, always know that the grocery stores are going to be probably the most contaminated because people just don't care. But also, you know, just do your best to help everybody else, because here people are getting tired of it. And you just see, I mean, I could just turn around and show you all the cars up and down the street, people walking everywhere. And it's okay to walk around everywhere, but when there's people are just living day to day, when they're supposed to be distancing and staying at home, that's all they can do is stay at home and be on top of each other here. So I can see why it's so rampant. This had to be the hub. You know, these bigger cities that are inner cities, it's just how it is.
So what you don't see, however, are the ones that have symptoms that don't come to the hospital, because we don't know those numbers, right?
No, we don't know any of those numbers.
And there's a huge number that you send home to ride it out, correct?
Yes, and we don't get those people don't get tested. So these numbers are not even accurate.
Right.
There are thousands of non-tested COVIDs. Thousands.
But you see, if you send somebody home, you see if they come back, right? And what has that looked like?
I honestly haven't. When they've gone home, they've been stable, discharged here, and come back. That's about day 6 or 7, like I was saying earlier. That's when either they have improved or they have declined. And so we see them right back and we know who they are right away. And we say, oh, and so we have to send them back. And I try to tell patients, especially here, and I don't think it's going to be that way in Arizona, but I tell them, you do not want to go to the back. And I'm just directly blunt to them and I say, you do not want to go back there because you're not going to come out. Because once you get on that ventilator, the percentage of recovery is very, very low. And the fact that we're running out of supplies and can't even take care of who we have here is also a big detriment. It doesn't mean that, I mean, they have the COVID, they're very sick, but we should be able to get them what they need, the basics. But there is no treatment for COVID. There's no treatment at all.
Right. I know there's not much else that you can say. I just wanted to share some realness with our tribe. And I just wanted to tell you how much we appreciate you and all the healthcare workers that are putting yourself at risk. I love you. I appreciate you. And is there anything we can do to help?
We don't require a lot. We require sleep and coffee, and that's about it, you know?
Well, how do you feel about your own health and your ability to withstand? Because you're obviously, it's everywhere around you all day long for 12 hours.
I'll be honest with you. The first 2 days, Beth, I had probably an internal anxiety issue for about 2 hours. And I thought, because I had just finally got into the middle of it, you know, and I thought, oh my gosh, I'm asthmatic. If I get COVID, I'm going to die. I did. I really did. And so, but then I got out of it and I thought, well, I've already had my 9 lives, so I should be okay, you know, but, but honestly, I mean, I believe this is what God sent me to do. And I believe that I'm meant to do this to help people. And even though I don't feel like I'm doing very much, even if I can help 1 or 2 and give them comfort care, then it's better than none. And so my expectations were a lot higher and I just couldn't reach them. So that being said, vitamin C, I've been taking vitamin C, been using the vitamin C patches, the multivitamin patches. I think the hard thing is staying hydrated. That's the biggest
Yeah.
thing. So when I get back, I'll get some vitamin infusions in me and I'll feel a lot better. So the biggest
Yeah.
complaint about my team is dehydration.
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 Well, you're going to be back in 2 weeks. We're looking forward to that. And we're wishing you and the whole team there all the best and praying and we're very grateful. Just wanted to say how grateful we are and hang in there. You are a hero, truly a hero.
Thanks,
We love you.
Love you too. Bye.
Take care. Bye.